Welcome, everyone. Happy Tuesday. Dr. Staci here. I'm so excited you all decided to join us this evening. They're still flying in the waiting room, so I'll be letting people in as I get started, get this kicked off. I wanted to start off by sharing with you that the information that I'm going to be sharing tonight is for informational purposes only, of course. I'm going to be speaking about LifeWave, its patches, the technology, how they work, and how they can help you improve your quality of life. But even though I'm a doctor, I'm not your doctor. And so the information that I'm sharing with you tonight is not intended to treat, to cure, or of course to diagnose you with anything at all. If you have any questions regarding your own health, please feel free to reach out to your healthcare provider, practitioner, if you have specific questions in regards to what's going on with you. I will be answering questions this evening, so hang on to your questions. I'm going to do a quick science and technology, be able to share some information with you about how this patch works, how these patches work, what they can do for you, get your frequently asked questions answered, and then open it up for questions. I will allow you to ask those questions in the chat, and so I'll be answering those as well too. So with that being said, we are super excited that you all have decided to join us. And if you're a guest here tonight, thank you for hopping on. I want to make sure that I give you a thorough overview of the science and technology of what this patch is, what it does, and how it works. And so if you are new here, or if you're a guest, what we're going to be talking about is a non-transdermal patch. It looks like this. It looks like a little round Band-Aid, okay? And so we're specifically going to focus on the X39, the stem cell activation patch. That's what we're going to start talking about first. I'm going to share that information with you guys. And so all of the patches do look the same, though. I'm not going to get into all of them, of course, but they do all look the same, but they all are different in what's going on inside of them. And that's what I want to share with you. So first off, like I said, this is a non-transdermal patch. And I'm sure you're probably familiar with transdermal patches like nicotine patch, birth control patch, pain patch. Those are a patch that you put on and a substance or a nutrient or a chemical enters into the body and something happens, right? Balances your hormones, whatever it may be for that specific patch. So that is not how this technology works at all. Okay, so scratch that from your mind. This is totally different. Non-transdermal means nothing is transferring into the body. No chemical, no nutrient, no substance, no medicine, nothing is transferring in. And so that's what I want you to understand first, get the basis of, is how is this working if nothing's going into my body? And so I want you to think about saunas, infrared saunas. How many of you have ever sat in a sauna, infrared sauna? Far infrared, near infrared, okay? Those saunas, I have one out in my gym right now. Those saunas have specific wavelengths of light depending on which program I pick. So if I decide I want to have pain reduction, then I will pick that program, and a very specific or several specific wavelengths of light will enter through my body and help reduce pain. If I pick the one that says anti-aging, then that's a different wavelength of light. It's going to enter my body and, of course, help with the reversing of the age in my body. I can pick one that says cardio, and it is a different wavelength of light that actually increases my heart rate and helps me feel like I'm actually having a cardio workout. Or I can pick one that says detox, and it focuses on detoxing my cells. Each program is a different wavelength of light that's entering my body. Do you understand that? That makes sense? Because that's going to help you to understand how this patch is working. It is working with a very specific wavelength of light. Each patch has a different combination of what's inside of it that I'm going to explain to you that signals our body. It brings in a different wavelength of light, signaling different peptides inside of the body. Okay, so if you look at the inside here, see that white part? That inside of that white part is a crystal lattice structure, and not a crystal like a clear quartz crystal or an amethyst. I always have these here so I can share with you guys. Not these kind of crystals. That's not what's in here. Okay. So embedded in this white part is a crystal lattice structure. And that's what David Schmidt has invented. He has invented this technology. And so this structure is made up of what he's invented, a proprietary blend of organic amino acids, sugar, oxygen, water. So that solution, those molecules that come together, that's what's inside of this patch. And so that patch works not with an outside light source like the sauna I was talking about, but it actually works with your body's light that you emit. You emit a low-level infrared light or body heat as you would know it, right? If you're going outside right now, I don't know where you guys live. I live on the East Coast and it's dark, right? And so I can't see anybody outside unless I'm looking through night vision goggles. Or my husband and my son just went hog hunting last week. And so they just got in today their thermal scope that goes on top of their gun. So they can, they can use it on top of the gun if they're going to, pretend like they're shooting things at night. Not that we do that here at nighttime, but they could just use it separately too. And so it will show them 500 yards out anything that's emitting heat. And so that heat that we emit, whether you're looking through a thermal scope or whether you're looking through night vision goggles, that is what this patch is working with. Okay. So does that make sense? So we put this patch on, our body's light or heat that we emit actually reflects back a specific wavelength of light from the lattice structure that's embedded in that patch. So you put it on your body, you just put it on. That's it. Put it on in the morning. When you get up, you can put it on the back of your neck, below your belly button, right here in the center of your chest, top of your big toe. It does not matter. But you put it on, you leave it on for 12 hours. During that time, your body is communicating with this patch. Our heat is reflecting back that signal, right? That wavelength of light. And so that is elevating what's called GHK-Cu copper peptide. And there's a great website. I'm sure somebody will put it in the chat for me. It's reverseagingwithghk.com. It's actually where David started his research 15 years ago, trying to figure out how to signal the body to activate its own stem cells. And he was researching Dr. Lauren Picard, which is who owns this website, reverseagingwithghk.com. And he realized through all of this research, the power and the benefits of increasing GHK. One of those benefits is that it actually resets a third of your genes back to their young, youthful, healthy state. Thank you, Heidi, for putting that in there. So young, youthful, healthy genes, that is really important when you think about what our body goes through in the course of its lifetime, things that alter our genes, especially now, right? With the toxins that are out there that are altering people's DNA, that's scary, super scary. And so knowing that when you put this on, this actually resets, upregulates a third of your genes back to their young, youthful, healthy state. Brand new, young, youthful, healthy genes. So we know that genes express to other genes. And so there is a beautiful compound effect I'm going to talk to you about here in a little bit. But I want you to really get your hands on this. You put the patch on, it immediately starts to work to upregulate a third of your genes. One of those genes actually mobilizes stem cells, your stem cells. This is not putting stem cells in your body. Thank God, right? This is not putting anything in your body. We're tired of having things go in our body all the times. And so not to mention, obviously, stem cell injections, which of course I did a lot of with my daughter in the past. They're extremely expensive, right? They can be controversial. You need to be really careful where you're getting them from. Of course, we were, but there are risks. It's a very invasive procedure, and there are risks that cells could divide incorrectly. And so you have to be careful with that, with what you're doing and how you're doing it. And so with this, there are no risks. Your body has its own stem cells. Did you know you were born with an abundance of stem cells? Millions and millions of stem cells. Stem cells are what we call pluripotent, which means they can turn into any cell or tissue or organ that the body needs. Like you're born with cells, heart cells, liver cells, kidney cells, brain cells, eye cells, right? But they can't turn into other cells. Stem cells have the ability to turn into any cell needed. And so they're your repair cells, your fixer cells, your healer cells. Those are the ones that go to work. When you have a cut or you break a bone, it's not the Band-Aid or the cast that's fixing it. It's your body that's repairing from the inside out. Those stem cells are doing that, right? They come to work to aid that process. That's why you see when you're older, your body doesn't repair as faster. If you break a bone, unless you're Sharon Arnold on here, who happened to be using the stem cell activation patch, and healed her wrist up there in 9 days. But unless you're her using the stem cell activation patch, when you're in your 70s and you break a bone, it may never heal, right? Now, if you're 7 years old and you break a bone, Johnny falls off his bike, boom, that body's repairing right away because he has an abundance of stem cells. And so as we age, our body makes less and less stem cells. They're not active anymore. Like they're there, but they're dormant. They're just not doing their job. They're tired. They're worn out. By the time in your 30s, you have about half. Think about when you're in your 30s, if you, maybe some of you still are on here, but think about that. You know how you started getting those lines, the crow's feet, maybe, you know, you had some aches and pains when you got up in the morning, or you didn't sleep as well, or how many of you guys have walked into a room and then turned around and walked out trying to figure out why you walked in that room? That starts to happen typically in your 30s, right? And so by the time in your 60s, you have less than 10% stem cells in your body that are active at all. And past 60, they're not, right? They're just dormant. They're just there and they're tired. They're old and they're wore out. And so what this technology does is it wakes up your stem cells. Let's go. Let's get moving again. And let's just go ahead and reset you while we're at it. So then that way you're young, you're youthful, you're healthy, you're vibrant, and you can go to work to fix, repair, regenerate, restore, and rejuvenate the body in whatever order your body needs. Remember, your body has its own innate ability to know how to heal itself. Like I said earlier, with the cut or with the bone, your body knows how to do that. But guess what? Your body gets out of balance. How's it get out of balance? Well, diet, lifestyle, injury, surgeries, stress, accidents, not to mention what we've been bombarded with the last 3 years. There's so much out there going on. Our bodies are getting out of balance on a daily basis almost, right? Unless we're doing something to combat that, prevent that from happening, or to reset that. And so when your body's out of balance, its ability to repair itself is declining, right? It's diminished. And we know, you know, those top 5 basically degenerative diseases start to kick in. You can start to see those based on, you know, just people. Around your 50s and 60s, we start to see the heart disease, the diabetes, the cancer, you know, the dementia, the Alzheimer's, you know, things like that start to come into the life. And you're like, I don't want these top 5 things. I don't want any of those. And so, or maybe you have them and you want them repaired. You want to reverse that. You want to get back your youth. You want to feel like you did when you were in your 20s or 30s. And you have the ability to do that with this patch. So when you put this patch on in the morning, like I said, it's immediately resetting a third of your genes back to their young, youthful, healthy state. It's mobilizing your stem cells. They're going to work to repair and regenerate whatever your body needs, in whatever order your body needs. You can't pick. This is not a stem cell injection. Remember, you can't say, oh, my shoulder hurts, put the stem cells here. Your body may say, and I'm sorry, your liver's shot. We're going to go work there before we get to your shoulder, okay? And so that's part of it too, knowing that it's going to take time. I want you to understand the timeline here. This is not a miracle cure-all, fix-all, like you're going to be perfect in, you know, 10 days or 30 days or even 60 days, honestly. This is regenerative medicine. And if you Google regenerative medicine, or if you know or understand what that is, regeneration happens in our body on a regular basis, doesn't it? Our cells regenerate, our organs regenerate. My gosh, every 7 years, we're a totally different person, completely. Everything's totally new, or in a good way or in a bad way sometimes, right? And so we are always regenerating, hopefully, in that positive direction, repairing the body if it's not out of balance. But what happens with this patch, the longer you use this, the more benefit you're going to gain from it. Like I said earlier, there's a compound effect. We know if you're resetting a third of the genes today, and I use this day after day, week after week, month after month, based on my age, it will get me up to that full stem cell regeneration point. So let's say you're in your 60s. It's going to take 6 months to get up to that full stem cell regeneration. Now, you'll have benefits along the way. I'll talk about those here in just a second. You're going to notice things, you'll feel things, you'll experience things. Things are going to, change. That's why we use our health tracker. If you don't have a health tracker yet, please get with the person that invited you here. It looks like this. The health tracker is going to give you the ability to keep track of your progress right here. See that? It's going to mark you out for the next 90 days. So at least you have your first 90 days, and then we'll give you another one so you can track that first 6 months. But let's say you're 60. It's going to take 6 months to get up to full stem cell regeneration. That's where your body's going to be producing and mobilizing enough stem cells that would be able to keep that body young and youthful and repairing itself, right? And maybe at that point you're like, okay, this is fantastic, but my things aren't completely perfect yet. Like, I still have some things on my health tracker there that aren't, at the top of the list as far as, longevity and vitality. Maybe you've got some things you still want to work on. I always call it like your grocery list of problems. And so you want to cross your things off your grocery list, right? Well, that's why I talk about longevity. We really start to see huge changes in that 6 to 12 month mark when you look at the reversing of the age, of the cellular age, when you look at the reversing of the functionality of the organs and cells and tissues. So a couple of weeks ago, I interviewed Dr. Eric Sanders. He's a pharmacologist from Europe. And I interviewed him about 1.5 years ago. And so it was great to re-interview him again a few weeks ago. And basically what he had shared back in the original one, and then again this last time, was he had a heart attack when he was 45 years old. And so, you can measure the heart and determine what age the heart is functioning as based on those different, the different types of tests they do with the blood flow in and out of the heart and whatnot. And so anyway, he was on 5 different prescription medications, statins, the whole 9 yards, and his heart was functioning as a 75-year-old. 45, heart attack, 75-year-old heart. Nothing changed. No medications changed it, nothing. He met a woman. She was, introduced to supplements, nutrition, holistic types of things, got off all the medications, did everything holistic, heart still functioning as a 75-year-old. So fast forward to when he found LifeWave. He was 64 years old. At 64 years old, heart still functioning as a 75-year-old. He starts the X39 stem cell activation patch. A year goes by, he has his heart retested. His heart is functioning around 37 years old. A year later, nothing had changed. Nothing was different. No diet, no lifestyle, nothing, just the patch. So here he is now 2.5 years later. He's like, my heart's still functioning as I'm in my mid-30s. I feel better. He looked incredible, better than he did the first time I met him 1.5 years ago. Feel better than I've ever felt my entire life. Literally feel like, he's in his 20s, maybe 30 years old. Just couldn't believe the difference in how he felt, and that his heart was still functioning younger than it ever had, right? He's 65 years old. And what's different? The patch, repair, regeneration, and time. We heard Dr. Harmon this past Saturday. If you were on the Zoom with myself and Dr. Harmon, we took a deep dive into 4 of the clinical studies, and he talked about being on the X39 for 4 months, and he went to his cardiologist, and he'd always had PVCs his whole life, like a heart murmur when you're a kid. He'd always, like miss a beat and things like that. And so he went in to get his heart checked, just thought maybe I ought to do that. And the doctor says, you have a right branch bundle blockage. You've had this for quite some time now. It's definitely going to, reduce your lifespan basically, and probably contribute to a lot of other things that are going to, kill you sooner than later. And so that was shocking and mortifying. And so he thought, well, I've got these patches. What else can I do? I'm just going to stay on them. So fast forward a little over a year later, he goes back to his cardiologist to get the test done again. And the cardiologist, because his PVCs were gone, they were completely gone. And his cardiologist says, I have no idea what has happened here, but your right branch bundle block is gone. That doesn't happen. Like, you don't have one of those, and then now you don't. That doesn't make sense. And he said, oh, it does to me. I'm on these patches. They can only repair and regenerate. But he said, what if I would have stopped? He's I think he's right at 70 maybe. He said, what if I would have stopped at 7 months? This didn't happen till a little after a year that I went back and had it retested again. Could it have happened? I don't know, but the time is going to pass no matter what. So a lot of you ask, how long do I have to wear these patches? You wear them as long as you want. If you decide you want to wear them for 6 months and then you stop patching, nothing goes back to the way it was before. Like, this is not a medication. This isn't, I take this pill and it makes my number look pretty until I stop taking the pill. It doesn't work that way. Regeneration repairs, regenerates, and restores and rejuvenates the organs, the cells, and tissues. And we have over 90 clinical studies. Like I said, Dr. Harmon and I just took a deep dive into 4 of them this past weekend. But if you go to startx39now.com, you can see all the clinical studies. They're all right there. You can print them all off. You can read them. You can read them on the website. I mean, all the information's there. And they're done by, obviously, David has done some, Lifeway, right? He has scientists and doctors that work with him, but they've also been done by independent labs and doctors all over the globe. This is actually a global product. We are in 81 countries. We have 5 corporate offices and 12 distribution centers. So you're able to purchase this product and have it shipped almost anywhere in the world, right? Shipping from your area. And so know that these studies are done from doctors all over the globe. So it's not we're just going to pay for this to make it look a pretty way. David spent 20 years inventing these patches, 20 years of technology and science and heart and soul has been poured into this to help people have a better quality of life. And so what people notice initially is they notice some things really in the first 3 to 6 weeks. I'm going to be honest with you. Sometimes people experience things before. Sometimes people feel a little bit, or they may have some things change. But I'm just going to go by clinical studies. We see about 80% of the people start to notice around that first 3 to 6 weeks pain reduction, better quality sleep, a deeper REM sleep, more mental energy, clarity, concentration, focus, more physical energy, faster recovery from exercise and even daily activity, and of course, faster wound healing. We see that all the time with people. I mentioned Dr. Sanders earlier. He had mentioned that he accidentally was trying to cut something this way and took the knife straight through his finger. Didn't slice it off, but pretty much you cut all the way through down to the bone and a little bit into it. And he said in 3 days, just a couple days, it was perfect. Never stitched it, nothing. Back just completely perfectly healed, like nothing ever happened. No nerve damage, nothing. And so that's huge, wound healing, right? And we know as we age, our body's ability to repair slows down. And especially when you get into wounds, you start to see the bruises, you start to get the where you break a hip or break a bone and things just don't repair like they used to. Well, this patch will speed up that repair process. We have so many people that have knee replacements, hip replacements, and that it's like miraculous. They're going back to their doctors and their doctors are like, I cannot believe I had a lady in shoulder surgery last week. And her doctor's like, how are you you're at least 2 weeks ahead of schedule on your recovery. How is this possible? She's like, well, I'm using this patch, right? Sharon, wasn't that on your team? Yeah, Lynn, I think so. Yeah. And so how's that happening? Because we're using this that is activating our stem cells. It is mobilizing and getting your stem cells to work to repair and regenerate. So you can use it as long as you want. Me personally, why did I use this patch? Because I've always wanted stem cells. I learned about stem cells 21 years ago. I banked both of my kids' cord blood before that was even a thing. And I spent over 10 years doing different types of stem cell therapy in and out of the country with my daughter. And so I always wanted them, but I didn't want the price tag, right? $25,000 a pop was not something we were going to be able to afford for ourselves for prevention and vitality and longevity for myself and my husband. But yet for my daughter, we would do anything to help her improve her quality of life. So when I found this just almost 2 years ago, actually, I thought, oh my God, it's the price of a cup of coffee a day. The whole family can afford this. Every single person can have stem cell therapy, our own stem cells doing the work like we were young, right? Just like we were when we were kids. And so it makes a huge difference when you look at that aspect, the price, right? When I'm thinking about, am I going to use this for a long time? It's the price of a cup of coffee a day. honestly, it's less than that. This is $3 a day. I know I was at a coffee shop the other day with somebody, and the person in front of me, their coffee was $7. Oh my gosh, what is in that? Liquid gold or something? I don't know. But they were a regular there. The person, at the counter knew him by name. And I'm like, holy cow. So $7 a day, that's a lot, right? When you think about that, but a couple dollars a day is not that much. And so when you think about longevity and vitality and prevention and reversing the functionality of your cells and organs, and again, backed by science, but also backed by personal testimonials. We have a private Telegram channel. We have over 3,000 people that have recorded their personal testimonial and how this technology has impacted their life in a better way. But for some people, I'll be honest, it takes longer. My sister-in-law was here earlier, and she's like, tell me, what is like one of the most crazy, awesome, dramatic things you have heard from somebody in the last 2 years? I'm like, oh my God, like I've got thousands in my head of amazing testimonials. I said, but I think one of the ones that I love is Rosemary. She's 85 years old. It's Catherine's mom, Mark's mother-in-law. And she was on back here in Sarasota last month, and she came up on stage, and, she was on a walker for 2 years, and she asked God to take her home. She was miserable and pain and just didn't have a good quality of life, and just couldn't do anything, right? And so her daughter found out about the patches, and she started putting the patches on her. She started patching, and nothing happened. Nothing happened. Not month 1, not month 2, not month 3, not month 4. It wasn't until 5 months that Rosemary just met her daughter and her husband down at the lake, and they turn around. They're like, Mom, what? How'd you get here? She's like, what do you mean? I walked down here. And she said, where's your walker? She's like, I don't know. I don't need that walker. What are you talking about? I don't need the walker. And she's 85 years old. She's been on a walker for 2 years. And so I told my sister-in-law that. She's like, what? I said, yeah, I think she's off all of her medications now. She was spunky as could be, and happy and lively and full of joy, and just so grateful to be here, and just sharing her testimonial up on stage in front of 500 people last month in Sarasota. And she's like, and I said, and she's running laps around everybody else in that place, right? And not on a walker anymore, and has a new zest for life. And so that's really what it's about, right? It's improving our quality of life, whatever's going on with you. Know that this technology can help you improve your life. And so again, this is the X39 stem cell activation patch. Before I mention, I'll let you guys ask questions. I know we were already getting questions in there. I do want to talk to you about Eon. And the reason why I do is because this was the #1 selling patch for over 10 years until David came out with the X39, which is just 4 years ago. And so the reason why is because this patch does a lot in your body. #1, it reduces inflammation. And we know inflammation, I'm sure if you've been to the doctor's told you you have inflammation, right? What do they want to do? Put you on anti-inflammatory medicines. You got to get that inflammation down. You're so inflamed, right? And so inflammation, we know, is the root cause of disease in the physical body. We've got to get to the root of the problem, and that is inflammation, right? And so when you reduce inflammation at the same time you're increasing your stem cell production, you're setting the body up for a more rapid, dramatic repair and regeneration process. And let me give you this example. David shared this one of the first videos that I watched of his when I joined a couple years ago. He said, if you go to get your shoulders, hurting, you've got range of motion issues, you go to get a stem cell injection. When you inject those stem cells in your shoulder, that area is inflamed, obviously, and some inflammation in your body is good, right? It's the body's trying to repair itself. But what happens is when that inflammation takes over, so the inflammation is like, you inject stem cells, it's like a moth to a flame. The inflammation is going to consume the majority of those stem cells. Say you injected 2 million, you may end up with 200,000. So that's why we call this the dynamic duo, because David says you want to reduce inflammation at the same time you're increasing your stem cell production. So that way you set your body up for that rapid repair and regeneration process. So these two, if you ask me about anything tonight, and remember, I can't talk about specific diseases or disorders or syndromes. I can talk about your symptoms. So if you want to talk about the symptoms you're experiencing, I can definitely talk about those. Or if you want to talk to me about an organ or a system in your body, I can talk about that. Because again, that's what our clinical studies are based on. But I'm always going to tell you X39 and Eon is your starting point, right? X39, every single thing, everything physically, mentally, emotionally, spiritually, X39. It's the second to it right there. We call that the dynamic duo, right? And this puts your body in a parasympathetic state, that calm, rest, relax, digest. Call it our happy patch. It's great for anxiety and stress, that kind of stuff, right? So you definitely want to use these two for anything and everything, okay? So I'm going to answer your question. So let me go back to the beginning just to make sure I get everything covered. So you have a man that's been on X39 for just 6 months. Doctor stated that he has a bulge in his aorta. What additional patches would be recommended? So obviously, remember, I'm not your doctor. I'm also not a medical doctor. I have a PhD in integrative medicine and a PhD in functional medicine. And so I do not specifically work with aortas. I'll just be honest with you, as I'm not an oncologist, right? That's not my specialty. So if you're looking at, for example, blood, if your blood is thick, Sharon had an experience with this with Colonel Tom here just recently, right, with patching. And so we look at Eon reduces inflammation. One of those inflammatory markers is fibrinogen. Fibrinogen is a blood clotting factor. Most people have a thick or higher fibrinogen count. Your blood is thicker. The fibrinogen content, the fibrin in your blood, is thicker or clumpy. That's a direct link to heart disease, by the way. You can research that. But I would definitely use the X39 and Eon combination together if I were looking at helping support my blood and keeping my blood flowing. And if you heard me last week with Dr. Mario, who is a cardiologist on Sharon's team, he was talking to you about the benefits of your heart in using the X39, the Eon, and as well as X49 and carnosine too. Right. He and Dr. Pamela did a fantastic job last week. So someone was told that you could wear the patch on the clothing if it's reflecting light back into your body. How could that work? So here's the thing. The patch, whether it's this side or this side, it doesn't, just by holding it in my hand, it's working. My heat that my body emits is about 2 to 4 inches outside of my body. You know that, right? You sit down next to somebody, you're like, oh, you're putting off all this heat. Or what if you're cold and you sit down next to somebody and you're like, oh my God, hold me, you're warm, I can feel your heat. That's what this is dealing with. This technology is working with that body heat. And so if you were to take this and put this on the inside of your jacket and go like this, it's still interacting with that heat in your body. So yeah, it's best to put it on your skin. But if say, for example, you have someone with sensory issues and they don't like things on their skin, Band-Aids, things like that, you can stick it on the inside of the shirt and just wear it like that. And it's still working because it's still communicating with your body. Remember, nothing's going in. So we always tell people all the time, don't leave these with the back on them and stick them in your pocket in your jeans or in your back pocket. You're going to have, lots of crazy, like you're probably going to be like, oh my gosh, I've got so much energy, I don't know what to do, because they are working no matter what. Okay. That's a great question though. So thank you guys for sharing the website. Do all stem cells in the body regenerate? For example, brain stem cells, I understand the body regenerates every 7 years. So yes and no. So our stem cells, as we age, become dormant. They just don't do their job anymore. They're not out in the body, moving around, repairing things, fixing things, getting things moving and grooving like they used to. They become tired and old. And that's why they always talk about doing donor cord blood, or when you're looking at stem cell injections, because you're getting young, youthful, healthy, brand new baby stem cells, right? Which we know obviously take time to grow and to mature. But if you pull out your blood now and you're in your 70s, you spin it and you put it back in, you're getting old stem cells, right? Basically. So it's not very effective when you look at what happens inside of the body. And so this not only resets a third of your genes back to their young, youthful state. Remember, in genes express to other genes, so that you have that compound effect over time, but it actually mobilizes your stem cells, resets them, and gets them working again. Pluripotent means that they can turn into any cell or tissue or organ that is needed. So it's not affecting your brain cells, or it's not affecting your heart cells or your liver cells or your kidney cells. The stem cells are what turn into what's needed in the body. They're pluripotent. So they're turning into this type of cells that's what stem cells do, that the body needs. Placement of patches. Yes, each patch comes with an instruction booklet. And I think I have, this is the only one I have in front of me right now. This is SP6, but each one comes with an instruction booklet with specific points to put the patches. The reason why is because, like I said, clinical studies, you have to have very specific locations that people are applying the patches in what would be like a controlled type of situation. You can't say, oh, you stick it on your forehead, you put it on your shoulder, you put it on your toe, you put it on your back. Like, we wanted to have specific locations, and David chose to use acupuncture points. He has rooted the research and studies with these patches in traditional Chinese medicine. So if you think about it, 6,000-year-old Chinese medicine and light years ahead of time technology with this patch, right? A wearable light technology. And so we have very specific points that are in the instruction booklet, because these points, these acupuncture points, are connected to meridians, of course, which are impacting organs and systems in the body. And that's why these spots have been chosen. But honestly, you know, when you look at your X39 stem cell activation patch, like, your whole body's heat. Your whole body is emitting heat. Even if your hands are cold, your feet are cold, your body's still emitting heat and light. Okay. So it doesn't matter where you apply the X39 stem cell activation patch. It's going to work no matter where you put it. It's working systemically. If in your mind you have a shoulder that hurts and you want to put it on your shoulder, then put it on your shoulder. I recommend you use Ice Wave if you have pain, because this is what it's designed to do, is get rid of pain on the spot. The X39 and the Eon are going to go to work to repair whatever damage is in your shoulder. So it's going to take a little bit longer. But placement, always follow the instruction booklet. Thank you for sharing the Start X39 Biz website for the health tracker. I appreciate that. Heidi is on it tonight. Thank you, Heidi. So yes, so the heart, Dr. Sanders, if you go to the Telegram, he was 65 when I interviewed him, and his heart had been functioning at age 75 since he was 45. And so now his heart's functioning around age 35. So yeah, 35, 37, yeah, something like that. I have so many testimonials in my brain, trying to keep them all straight. So as far as preventing bacteria, virus, disease, that kind of stuff, so you would, that's why I'm using this. Hello, prevention. Yeah, it does. It definitely prevents. So you would use X39 Eon and glutathione. Glutathione is the master antioxidant, master detoxer, master immune booster. Most of you are probably familiar with glutathione as in a push at the end of an IV vitamin therapy, or maybe you're used to it as a supplement that you take, or sublingual, suppository. So glutathione is, like I said, it's the master antioxidant. It is going to chomp up free radicals, toxins in your body, neutralize toxins, right? Help to eliminate those out of your system. But here's the thing, when you take a supplement, an outside source, you're only going to increase your glutathione level about 20-23%. And glutathione has about a 7-minute half-life in your body. That is not very good when you think about the coverage, right? That's why, I mean, I talked to a lady the other day, she's taking glutathione 4 times a day, right? People are going every other day to get IV pushes of glutathione at the end to try to increase their glutathione level, but it's only 7 minutes that it's active in the body, and then it's gone. So this patch that David invented, it's exactly, it looks just like this. It's a proprietary blend of amino acids, sugars, oxygen, water that form a lattice structure that signal a different peptide. It actually signals a peptide in the liver to increase your own glutathione level. Actually increase it by over 300% and sustain it for a 24-hour period. So you put the patch on, you leave it on 12 hours, you take it off, you throw it away, but your glutathione level is still elevated for another 12 hours. So that means you have a total of a 24-hour period that your glutathione level is over 300%. And those glutathione, that antioxidant in your body, your glutathione, is going to work to get rid of free radicals and toxins in the body. That's huge. There's nothing out there on the market that does this. Nothing. Like, you can do coffee enemas to increase your glutathione. Who wants to do a coffee enema every day? Not me. Absolutely not. Not interested in that. No, I'm going to drink a cup of coffee, but I'm definitely going to put it in this way, not the other way. And so I'm all about wearing a patch, wearing that patch 12 hours, taking it off, throwing it away, knowing that prevention is happening right here. This is your prevention for any type of, sickness or anything like that. I'm not saying you're not going to get a bug every once in a while. We all do, right? That's part of it, but it definitely will boost your immune system, help to detox your body. And if you have COVID or any type of, virus or anything, if you saw Dr. Brian Daly or heard of him, David has done clinical studies with the X39 glutathione with helping people to eliminate those symptoms and long haulers and things like that from the virus. You can find that on my YouTube channel. I put that on there so you guys can watch that. He actually screen shares different slides and stuff. I loved it. It was fantastic. So if you stop wearing the patches, how long would it stay before your body starts to age again? That next day. So our body is aging every single day. Every single day it's aging, unless you're doing something to reverse that age, to reverse that functionality. It's aging every day. I mean, I read in my functional med PhD, one of the books, it was all about aging, of course. And one of the books was talking about the aging process and when it starts. And it talked about around age 11, actually. I was like, that's interesting. That's the first time I'd ever heard that. But age 11 is when that aging process starts to happen. And what typically starts to take place around age 11 for boys and girls? Hello, the beginning signs of puberty, right? Girls get the little of this, the boys get a little of that. You start to leave a little hair here, right? Those types of things start to happen around 11. That's when we start our aging process. That doesn't ever stop. Okay. And so when you stop using the patch, your body is just going to start aging from that day forward. So let's say, for example, I see Laura on here now at the top. Hey girl, Laura went and had her test done to determine her cellular age. After 1 year of using the patch, 60 years old, doctor says your body's looking like you're 40 years old. Fantastic. 20 years younger than what your biological age is. Now, if Laura were to stop patching, which we know she's younger now, she's in her 30s, but if she were to stop patching right now, and let's just say her cellular age, her inside is, let's say it's 35 years old. Okay. She's 60. Look at her. She looks 35. Okay. So I'm glad she's my friend. We're like, so cute. But anyway, so she's 35 years old. She stops patching. Well, then she's 35 in 1 day, 35 in 2 days, 35 in 3 days until she's eventually 36. And then she'll eventually be 37 the next year. Do you see how that makes sense? It's not like you turn to a pumpkin overnight and then poof, everything you gained is just gone. It doesn't work that way. Remember regeneration. So your body will just start aging at the next day from that process, just as it normally did, right? That's a great question though. Okay, so 3 weeks in detox, whipping my butt majorly. So if you're feeling any type, I love Dr. Harmon said that this weekend. If you're feeling any type of detox symptoms, it's not the patch. It's your body. Your body is trying to eliminate the toxic things that are inside of it. We are full of heavy metals, of parasites, of bacteria, of viruses, because we're people and we're exposed to everything, right? Earth, water, air. We're exposed to all this stuff, which is full of, all these microorganisms and everything. And so if you're not feeling up to par, make sure you're staying hydrated. Half your body weight in ounces in water today. I went to get a lymphatic massage today. Thank you, Laura. And the lady said, how much water do you drink a day? I said, I drink 34-ounce bottles every day, plus some extra water. Obviously, I don't always drink out of that bottle. I have RO water at the sink. I said, I drink a little extra water depending on if I'm in the sauna or if I'm, what my workout looks like. But I said, at least get minimum of 4, at least a gallon of water every single day. So if you're not drinking half your body weight in ounces in water every day, you may not feel as good as you could or should feel. So half your body weight in ounces daily. That's how much you should be drinking every single day. Now, I know some people say 64 ounces, and I'm like, that's fantastic if you weigh 120. Laura, perfect. You weigh less than that. Me, I haven't weighed that since 8th grade. Not gonna happen. Not in this body, in the rest of this lifetime. I will never weigh 120 pounds again. It's not happening. So I have to drink a lot more water than that. Now, obviously I don't weigh 200 pounds, but still I always make sure I'm hydrated. And of course, like I said, exercise, sauna, I overhydrate. I like my cup of coffee. That dehydrates you. Got to make sure you stay overhydrated. And then I live in Florida. It's flipping 85 degrees in February. So we got to stay hydrated, right? Water is key so you feel good. All right. So Staci, let's see, you say, why would you stop wearing it when you want? Wouldn't that be counterproductive? Well, I always tell people it's your choice. You can stop patching whenever you want. That's your personal choice. I'm not going to tell you what to do or not do, right? I always say stop patching whenever you want to start aging again. So for me, I'm patching every single day because I'm 25 on the inside and I'm feeling it and living my best life. And I'm going to do everything to prevent that anything else happening, right? And David says we should live to be 150, 200 years old, barring accidents. Now, honestly, if you live here in Florida, stay off of I-75 if you want to avoid accidents. But for the rest of you guys that live in, areas that are not overly populated, probably not going to have many accidents happen. So we should be able to live a very long time. But I never want to say you have to do this or it won't work. You will definitely get benefits from the patch if you just wear it for, 6 months, 12 months. Of course you will, right? How can we help some with polymyalgia, okay, tell me a little bit more about that right now. If you're talking about maybe rheumatoid arthritis, I'm not really for sure. So off the top of my head, I'm not familiar with that one. Maybe give me another message with some details on what that is. Let's see. Can you patch while on dialysis? Yeah. You remember Roberta? Was it Roberto? You just asked me about that yesterday, didn't you, Laura? 41 years on dialysis. I interviewed this man. 41 years. He was 16 when he went on dialysis. Oh my God. 6 weeks after using the patch, he's urinating on his own. I mean, we all no one had a dry eye on that Zoom. We were like, how is this possible? This man, Bob Campbell took a pill for 15 years, 14, 15 years? He couldn't urinate on his own? Not anymore. Not after the patch. Okay, so how is Ice Wave different from Eon? Great question. Ice Wave opens up energy channels. Pain, stuck energy. It works with the polarity of your body. There are 2 patches. There's a white patch and a tan patch. That's what Ice Wave does. Polarity, right, left. Okay, white right, tan left. Shoulder hurts, white right, tan left. Headache, right here, tan left, white right. Wherever your pain is, your knee hurts, wherever the pain. If your left knee hurts, stick the tan one on the left knee, put the right one on the right knee corresponding part. This opens up energy channels, eliminates pain on the spot. Move it around until you find that location that's going to get rid of the pain. But your pain should be gone in minutes, seconds, minutes. Worst case scenario, maybe an hour or so. Worst case scenario. But Eon, no, that's totally different. This, like I said earlier, this gets rid of inflammation, reduces inflammation, inflammatory markers, the homocysteine, the cytokines, the C-reactive proteins, lipids, fibrinogen. It brings your body into a parasympathetic state, works with anxiety, stress. We call it our happy patch. Totally different. This signals a peptide in your liver to upregulate your own SOD and downregulate those inflammatory markers. No comparison in how they're at all, but they work really well because this is going to help you get rid of your pain that you're experiencing immediately, while these 2 are going to work to repair and regenerate whatever is going on in your body and getting down to the root cause of the problem, right? Okay, so next question. If you are restricted on fluid intake, can you still wear the X39 patch? So here's the thing. You can still wear the patch always. There are people, believe it or not, a lot of people that don't drink half their body weight in ounces in water every day. We're trying with you guys. We're trying to get you to drink your water. We tell you, take a gallon jug, soak it in strawberries or pineapples or lemons or limes or grapefruits or whatever, mint, rosemary. I don't care. Just not vodka. But soak it in something at night. Drink it the next day, okay? Get your water in that way. If that's the way you need to get it in, get it in. But if you're restricted for some reason, you may not have as good a results because your cells are light. We are trillions of cells of light. Like that is a fact. We know that. And so the water is what your cells need for conductivity for this to really work. This works intracellularly at the cellular level. You're biocommunicating. This is a biophotonic exchange of information. So it's the biochemical processes happening inside of the body. Body needs water. Okay. So you can still have benefits. Obviously, most, like I said, people unfortunately don't drink the water we want them to drink, and they do have results, but you could have a headache. I don't know. I mean, sometimes people have a headache or they feel fatigued when they're not hydrated enough. So when you're looking at any type of virus in the body, we would always use X39, Eon, and Glutathione. So like everyone has Epstein-Barr. If you don't know that, read Medical Medium. It's a fantastic book. But we all have Epstein-Barr. We were all born with it, more than likely, or, you know, had it very soon as a child, just from your environment. It's just what we deal with in the United States, especially. But you can detox your body from that. So definitely read Medical Medium. He has great tips in there. As far as tremors, a lot of people with tremors. I loved what Dr. Pamela shared last Tuesday on the Zoom. X39 on CV7 and X49 in the center of the abdomen. So like about 3 fingers above the belly button. She recommends using the X49. X49 is David's most recent patch. He invented this to help with building lean muscle mass, reducing bone loss, increasing bone density, as you probably saw if you saw Dr. Herman and I last Saturday on the Zoom go deep dive into the X49's benefits. But one of the other benefits is it works directly on, of course, we know the brain. You heard Dr. Mario talk about that with me last week, but the heart, with the heart, but the brain as well too. And so we see improvements neurologically with people with X49. And of course, tremors are coming from the brain, right? Those like, it's not your hand that's messing up. Something's happening neurologically that's causing that. And so we can see great benefits with the X49. And Dr. Pamela had mentioned that spot in your abdomen, a few, you know, like I said, 3 fingers above your belly button. So I would try that X49 there. We love carnosine. Carnosine is a patch that loves the brain as well too. It balances left brain, right brain hemisphere, improves cognition, communication. If you were just to Google carnosine as a nutrient, not our patch, but just a nutrient, you can see that it actually eliminates heavy metals like aluminum from the brain, which is super important. When you look at any type of neurological condition, please look at toxic load in your body, the heavy metal in your body. You may not think you have them, but you do. We get heavy metals from our environment. We get them from our water, from our food. We get them from our personal care products and our cleaning products. We get them from the aluminum pans we cook in or the aluminum foil we use. Or we get them from the fillings that are in our mouth, which is probably the most common cause of heavy metal toxicity of neurological problems, are the amalgam fillings that are in your mouth that are mercury and that are leaching into your brain, into your body. So if you don't have yours out yet, go find yourself a holistic dentist to get those out and really look into some types of heavy metal detoxes to get these things out of your body, right? You don't want to have toxins in your body. And of course, you know, when you look at a virus load and a heavy metal toxic load, then you kind of set that environment up for a cancerous environment. So you want to make sure you're reducing the amount of toxins in your body and reducing the amount of harmful viruses like the Epstein-Barr. We don't want that in our body, right? As far as, we don't have any clinical studies on X39 lowering cholesterol. And to be honest with you, cholesterol is something they can write a prescription for. So you might want to look at, like I mentioned earlier, fibrinogen, which is a direct correlation to heart disease, and looking at reducing that fibrinogen level. We do see improvements in people's blood work, of course, using the 39, the 49, Eon, carnosine. Those are our heart patches we talked about last week with Dr. Mario and Dr. Pamela. So cells will regenerate 1 year versus 7 years when using Fantastic 5. We don't have any clinical studies on that, but we definitely see improvements in speed, right? Nirvana is for pain. Oh, you know what's so great? I got a text earlier from Wendy. She's out in California, and she said, Staci, I heard you talk about the Nirvana system on one of our Zooms and how that using that will actually eliminate full body pain. And she said, I dealt with so much pain last year, and Ice Wave just wasn't cutting it. You know, it was too many places. And she said their Nirvana took care of it. And I cannot believe how I feel now. So I was like, yay, that's so exciting. So exciting. So if you're looking for pain reduction, then you would want to use the patch with the supplement. Okay. And that's what David said when he was sharing the information from the clinical studies. When you're looking at pain reduction, elimination through the whole body, the patch, the Nirvana patch, and the supplement that comes with it. It's the only supplement we have. You put the patch on, say, for example, in the morning, and you take your supplement in the morning. Between 1 to 3 weeks, this is per clinical studies, every participant not only had mood balancing, stabilizing, they had, happy, blissful states because it works with your brain to help with, depression, anxiety, and things like that. They also had full body pain elimination. And the reason why is Nirvana increases your beta endorphins. And beta endorphins are the body's natural pain killers. They can't give that to you in the hospital, of course, because it's so fast acting, it's gone. Like if you're in an accident, the beta endorphins are what stop you from immediately going into shock from the pain, right? You typically don't feel pain. Think about when you cut your finger. You don't actually feel the pain instantly until you look down, you're like, there's blood. And then you're like, oh my God, it hurts. And so it's the beta endorphins that kill the pain instantly. Well, when you use the Nirvana patch and supplement, that is 20 to 30 times more powerful than morphine. You got to use the patch and the supplement together. So stem cells, I don't know if they can repair a narrowing colon. I'm not really for sure, but I know stem cells can repair anything and everything in the body. So it's worth a shot. So Eons for chronic pain, Ice Wave is for healing. So Eon is not designed to eliminate pain. It reduces inflammation. And we know a lot of times inflammation is painful. So someone asked about neurological damage from psych meds, nerves burning, that kind of stuff, brain fog, headaches. So I would use the X39 for sure, the glutathione and the Eon, just because of needing to maybe, get rid of some of those heavy metals and things like that are in your body. The medicines are extremely toxic. That's why, anyway, we don't have time for that, but those would be 3 really great. And then if you're in pain, if you look at nerve damage, like the Ice Wave, a lot of times that will help eliminate use like K1, the bottom of your feet, the balls of your feet, that part really helps to eliminate pain throughout your body. What patches are good for someone with kidney not functioning anymore? She's 85 and the doctor doesn't suggest kidney transplant because of her age. I would use the X39 and Eon for sure. I would also add in the carnosine. It's great for the organs as well. We have great clinical studies. Honestly, the entire YH series, the Eon, the glutathione, and the carnosine, I don't think you should start all of those at one time, of course. X39 and Eon are a great starting point, possibly carnosine right out of the gate with that as well too would be a good addition, and then kind of work your way up to maybe adding in that glutathione. As far as where to put the patches for dementia, on the body. X39, Eon, carnosine for sure. Put them on the body. Pick a spot. Any of the spots in the book will definitely work. Okay. Let's see. Can you wear all the patches at the same time? No, you actually can't. So X39, X49, and Energy Enhancer are daytime only patches. Only in the daytime. Okay. They cannot be worn at night. The Alavita, and I don't have my Silent Night sleeve in here with me, but the Alavita and the Silent Night are nighttime only patches. They cannot be worn during the day. Okay. And so those are that. Got it? All the other patches you can do daytime or nighttime. So let's say you have on X39, you have on Eon, you have on X49, you have on Energy Enhancer, you have glutathione, you have carnosine, you have Nirvana, SB6, you have Ice Wave. You can wear all those during the day if you want to. It's not going to hurt you. Here's the way it works, and I don't recommend you start this way, but each patch signals a different peptide in the body. They are not doing the same thing. They're signaling different peptides. And so these peptides are in your body already. They're supposed to be doing their job. And maybe they're doing some of their job, but not functioning at full capacity, right? Or maybe they're not doing any job at all. So the patches are going to signal different peptides. So you can wear them all together and you can all wear them individually. Start with whatever works best for you. I don't recommend you go and put on 6 patches at one time. unless you have like absolutely nothing wrong with you and you just want to like go crazy like I did when I found out about these 2 years ago. You can put Eon anywhere on the body you want. It's totally up to you. And yes, you can wear the patches together, definitely. Just want to make sure. I know we're out of time here. We had better control blood pressure. Yep, that's X39, X49 for sure. Carnosine, Eon, those are fantastic patches when we look at the cardiovascular system as well too. And someone had diarrhea the first time they were patched. She put the ice wave on in the afternoon. Could that have been a detox reaction? She'd been using 39 Eon and 49 prior to this for over a month. Well, I mean, it opens up energy channels and stuck energy. We know that if you guys have ever had colonics, there's stuck energy, and there's no energy in fecal matter. There's not. It's just dead, right? It's decaying in there. So yeah, it could have moved things through. It could have. It's not a common thing that happens. No, I would say probably people tell me with X39, they noticed some improvements in their bowels within the first couple of weeks for sure. You can wear your you can wear your patch during the sauna, or you can take it off and reapply, whatever works. Brent sits in the sauna in the evening time. He always patches with his on. I sit in the morning before I patch because it's early. So you can definitely, yeah, whatever you want to do. What patches would you recommend helping the body fight Lyme's disease? Oh, so getting to the root of that, that's a lot, right? There's a lot of components that go to that. So you would just have to start with your X39, your Eon, your glutathione. You know, and just kind of gauge there. You might look into eventually looking into the endocrine system, of course, the SB6, the carnosine, maybe even energy enhancer to turn over the lymphatic system, get some of that stuff out of your body. I will be recording this. It is recording. I'll be uploading this to my YouTube channel here in just a minute. Okay, so thank you. Inflammatory disorder. I was thinking rheumatoid arthritis, muscle pain, stiffness, that kind of stuff. Okay, fantastic. Yeah, so I would definitely use your X39, your Eon, and your glutathione when you're looking at pain, arthritis, those types of things, stiffness, muscle, shoulder, absolutely. And if you have specific areas of pain, you could use the ice wave, the X39, Eon, and the glutathione for sure. All right. So if you feel dizzy when you're wearing the X39, take it off the back of your neck and put it below your belly button. Those are 2 totally different acupuncture points, or put it on your top of your right foot. If you feel like it's sometimes up here, this is a huge energy portal. There's a lot of nerves coming into CV7. And so you may have a little bit of a dizziness. Again, water hydration is super, super, super important. Okay. All right. So, IceWave, go to YouTube and type in LifeWave Health. LifeWave Health you can type in IceWave. You can type in LifeWave IceWave at YouTube, but you can see all of the patches. David does videos on every single patch on the YouTube channel. Okay, so you guys, I know we're running out of time here tonight. We're a little bit over, but if you have any other questions, please get back with the person that invited you. They can help you get your questions answered. If they're not really for sure, they're connected to somebody in this organization that can definitely get your questions answered. We're all a big, huge network of people that are working together to help people improve their quality of life, obviously. So thank you all for being here tonight. I appreciate you, and definitely look forward to seeing you all again on our Zoom. Patching podcast is happening right now, so we'll want to jump on that. We do those every single Monday through Thursday night at 9 p.m. Eastern, and of course on Friday at 4 p.m. Eastern. So we look forward to seeing you guys on those. Have a fantastic evening.